Hi there, my name is Christina Jordan. I'm a board certified Master Nutritionist, and today I get the honor of chatting with you about our Fit Body's bioavailable, bioidentical hormone replacement therapy. This is an amazing all-natural program that's going to help you get yourself back on track, get back in balance, and it's amazing for women, especially women over 35. So before we begin, I wanted to share a little bit about myself and my personal journey with this amazing hormone replacement therapy. Well, I'm in my mid-40s, and I noticed when I turned 40 years old that along with an extra candle on the birthday cake, within a month, I literally discovered that I was having hormone replacement issues. I didn't know at the time that's what it was, but I was having horrible symptoms that I had no idea on how to identify with. I didn't know that I would be in perimenopause after turning 40. I had no idea. And so for me, my journey started with I couldn't sleep. It's like I turned 40 and I couldn't sleep. I got hot flashes. I was exhausted. I had a very low sex drive. I was very emotional. I was crying at everything. I just felt like I was off. And on top of it, I was gaining weight. Whereas before, I had lost over 130 pounds. I had easily maintained my weight for a decade, turned 40, and poof, it was like all of a sudden, all hell broke loose and I couldn't figure out what was going on. Does this sound familiar? And on top of it, I don't think I slept. I didn't have one good night's sleep for 6 months after turning 40. And that's when I decided that I was going to try bioidentical, bioavailable hormone replacement therapy. Now, I had heard a lot of stuff about therapy, replacement therapy. I had heard different rumors about it. I mean, the only thing I knew about it was I thought that's what your grandma did. Well, this is not your grandma's hormone replacement therapy. This is designed for women who are 35 plus and struggling with any of those symptoms. These symptoms can include, and let's go over the symptoms: fatigue, exhaustion, inability to sleep, hot flashes, pelvic pain, low libido, low energy, low endurance, no zest for life, not liking people, not wanting to be around people, not wanting to touch or hug or kiss your partner, not wanting to be around crowds or groups, feeling lack of motivation, having mental fogginess, grogginess, forgetting basic things, just literally forgetfulness, feeling like you're out of place, not feeling like yourself. I also noticed it in my hair, my skin, my nails. My nails started breaking, my hair started falling out, my eyelashes fell out, my eyebrows fell out. I started noticing hair thinning right here called alopecia. My hair got brittle, my skin got dry and brittle and itchy, tingling skin, frequent urination, constantly feeling like you have to urinate, bloating, swelling, strong PMS symptoms. I also, on an even more serious note, I started developing symptoms of PCOS, polycystic ovarian syndrome. I started having severe ovarian pain. I started feeling like my body was just turning against me. I also developed higher autoimmune reactions. I noticed that my body wasn't healing. I started bruising easily. Yes, that's a huge sign, by the way. And on top of it, I was just having erratic PMS issues. So those are a few of the symptoms. Believe it or not, but hormone imbalances is related to more issues than you can even realize. In fact, did you know that if you are out of balance hormonally, you have greater risk of developing breast cancer, brain cancer, autoimmune disorders, diabetes, obesity, chronic fatigue, fibromyalgia, and also issues with heart disease and even liver conditions. So all of this is because we're out of balance. Also, did you know that 100% of women will experience menopause and perimenopause? And that's why I really thought it would be an amazing thing, because it's so greatly helped me and in my journey to bring in bioidentical, bioavailable hormone replacement therapy for my patients, because it's helped me so much. And I've been now on hormone replacement therapy for 18 months, and I can tell you it's night and day. I feel like a new woman. I'm sleeping. I can sleep through the night. I don't have hot flashes anymore. Huge for me is the pelvic pain and the ovarian pain I was having gone. And that was gone in my first 30 days. I was sleeping better in my first 30 days. I immediately noticed a huge boost in my mood, in my mental focus, and in my sex drive. Like, night and day difference. I can tell you that I have had such a turnaround. I feel like a new person, and that's why I think it's so important that we have a really honest, open discussion about bioidentical hormone therapy and how this is not your grandma's hormone therapy, okay? So the first thing I want to talk about is what's the difference between bioidentical, bioavailable, and synthetic, like what's available in a lot of birth controls. Well, first of all, it's kind of like this. I explain it. It's like having two women walk in with a blouse on. One is made of polyester and the other is made of cashmere. And there is a complete difference. They're both wearing shirts, yes, but they are totally different in the way that it interacts with your body. So cashmere is a natural ingredient. It's soft, it feels good on the body, whereas polyester is fake, it's actually constricting, and it's actually been shown to prove to actually attract cancer cells. So for my patients and for myself and for my friends and family, I would never ever recommend you do synthetic hormone therapy. Not only does it not interact well with your cells, it's also very dangerous as it is synthetic and it can cause cancers, it can have a lot of interactions, and it's just straight up dangerous for your fertility and for your sexual reproductive hormones. Bioidentical, on the other hand, is very soothing, it's gentle, it's amazing for balancing out your body gently and naturally, and bioavailable and bioidentical means it's just a fancy term for meaning it is identical to the hormones that are already in your body now. It's identical. So what does that mean? It means your body absorbs it easier, it absorbs it better, and it's amazing if you are suffering from imbalances. The other thing that sets us apart versus this program versus a traditional program where they're going to give you synthetic hormones is the medical labs that are usually done. When I first started my hormone replacement journey, I didn't know where to turn. So I turned to where a lot of other people do. I got thousands of dollars in medical lab draws. I got a lot of blood work done. I got poked a ton of times. They burst my vein. It was just a horrible experience and super expensive. I paid over $2,000 for one round of testing. Then I did it again. And each time that traditional test showed they're fine. Literally, the doctor came back and goes, your lab results are fine. Have you experienced this before where they're like, we ran the results, you're fine, but you're like, I don't feel fine. So I worked with one of the top hormone experts in the nation and in the world, where he literally has spoken on multiple platforms. He trains other doctors and other physicians and other medical providers on the topic of bioidentical hormones. And I had a sit down with him and we made a plan. And he explained to me and mentored me on the topic of bioavailable, bioidentical hormone therapy, that sometimes the blood work is not a good indicator. In fact, he said 90% of the time the blood work means nothing. It's symptoms. It's coming up with a plan to get to the root cause of that. And he explained that there are going to be times where you're going to get your blood work done and it can show that your hormone level is normal, but the receptors in your body, you're not actually receiving that particular hormone, so you're not absorbing it. So what does that mean? It means on blood, on paper, you look fine, but truly in your body, you're not fine. You're out of balance, you're too low or too high, and your body is not receiving what it needs. So now we have symptoms. He said, as an expert, a top hormone expert, he said that the way to know is look at the root, look at the symptoms. And so he gave me a list of like 20 different things to show, do you have this, do you have that, and what degree? And on the list of 20, I had every single one of them. My body was so out of balance. I had every single symptom available to one degree or another. And I actually ran really high on some of them, to where he's like, there is no question on if your body is out of balance. There's no question that your body wouldn't benefit from being more balanced. And here's how I knew that it was a good choice. Because not only was I experiencing an uncomfortable lifestyle from it, where I was withdrawing, I didn't want to be around people, I was exhausted, I was tired, I was craving sugar like crazy, but it was also affecting my health. My insulin was going crazy, I was becoming extremely insulin resistant, my cortisol was high, I was developing adrenal gland issues. On top of it, my body wouldn't heal. I had had a surgery when I turned 40 to correct some broken ribs that I had gotten from pregnancy. Long story there. I had a giant baby and he broke them while in the womb. And I decided, I'd put it off for so long and we were going to repair that area. I couldn't heal because my testosterone and my hormones were so off and so low, I couldn't heal. And so it wasn't until I started hormone therapy that my body actually, 1, I lost weight, 2, I got more energy, and 3, I started healing. And I had every single symptom, including I bruised so easily. I could barely hit my knee on the side of a bench or something and I would have a giant bruise. After workouts, I hurt so bad and my body wasn't healing and repairing muscles, so I wasn't building muscle. I felt flabby, I felt soft, I felt tired, I felt fatty, I felt swollen, my face was swelling. I started developing high cortisol moon face where I was starting to balloon out. And all of this happened at 40. It's like, congratulations, welcome to the 40s club. You have a hormone imbalance. Super. So for me, hormone therapy changed everything. I lost 52 pounds. My hair grew back, my lashes grew back. These are my natural nails. My nails grew back. My skin became softer. My mood improved. I no longer felt afraid to go into crowds or it was more like I had anxiety from crowds. I all of a sudden stopped being so emotional. I started feeling more calm, more at peace, and praise God, I could sleep again. I was sleeping through the night. I also had such an improvement on my energy that now I'm able to work out again. I feel like myself again. And I feel like how I had energy back in my 20s. So when people tell me, how old are you? And I tell them I'm in my mid 40s, and I can honestly say, I don't feel like I'm 42. I feel like I'm 24 because I have such good energy and my body just feels like it's cooperating. All of those symptoms, I will tell you this, every single symptom I had, including my PCOS issues that became horrible at 40. They hadn't bothered me in years. And then when I turned 40, they popped up, are gone. And I even have medical proof from going to my OBGYN, going to my medical doctors, and working with this hormone expert. We have blood panel proof that I'm back to normal, and not just on my hormones, but on my insulin resistance. It's completely under control. My triglycerides are better. Everything is better. Everything is better. And those symptoms are gone. Thank goodness. And so that is what we do here. We have taken that same idea of that medically created, medically proven, scientifically backed test to see where you might be lacking, what symptoms you're having, and as to what degree. And we're able to make a custom recommendation for bioidentical, bioavailable hormone therapy for you. Traditionally, what we see predominantly is most women that are 35 and older, they're estrogen dominant. Estrogen dominant is making us fat, it's making us obese, it's making us have insulin resistance, it's making us diabetic, it's giving us severe PMS symptoms, pelvic pain, severe bleeding, PCOS, polycystic ovarian syndrome. We're seeing a lot of issues where women are having insulin resistance, high cortisol, mood disorders, and it's all from being estrogen dominant. We're seeing it in the men too, but today we're talking about women. We're also seeing those who are estrogen dominant are 80% more likely to get breast cancer and other cancers because the cancer cells love that fatty estrogen dominant tissue. It lives in it, it loves it, and it loves to grow in it. And so for me, my mom has had breast cancer, my aunt passed away from breast cancer. I'm not gonna play any games with if there's a way that I can prevent myself from being exposed to risk to breast cancer and other cancers, obesity, and then of course, the diabetes. 100% of my family, my older generations of family have had diabetes and obesity, and I don't wanna do it. And the truth is, even though 100% of women in the world suffer from perimenopause and menopausal symptoms, it doesn't mean that we have to go silently into the night, and we can fight back naturally, healthfully, and prevent cancer, prevent aging, prevent these symptoms, prevent having our life stolen from us just because we turned 40 or 35 or 50, and it just depends, because menopausal symptoms they're seeing it start as young as 34 years old, and then it can last anywhere from 34 on up. And so for me, mine happened to come at 40, and I'm like, nope, I'm fighting back. So what we do is, if this is something you're interested in, we offer a totally complimentary hormone replacement medical exam test where we can see what symptoms you have and what you need. Then based on that, we will custom compound you a bioidentical, bioavailable, custom compounded hormone medication for you. And then we'll either give it to you in person and do a consultation, or we'll ship it to your home and do a consultation by Zoom or over the phone, whatever you're comfortable with. And this way you're able to get exactly what you need. You're able to get your symptoms met, not just another lab that tells you nothing and costs you thousands of dollars. And best of all, our program is all inclusive, which to me, it has to be a holistic hormone plan. Otherwise, it's not going to work. This is what separates us from your grandma's hormone plan. Your grandma was most likely given some prescription for a synthetic medication and sent along. They didn't fill her in on what foods to eat. They didn't tell her what workouts she should be doing, what lifestyle changes she should be making. That is what we do here. You get everything you need. You get the eating plan, you get the home workout guide, you get a lifestyle plan, and you get a 90-day supply at a time of bioidentical, bioavailable hormone therapy. And that's amazing. And it's all inclusive. So you don't have to worry about labs and thousands of extra dollars coming out. It's all inclusive. You know what to plan for. And best of all, you guys, you're going to be under the supervision of not only the medical team, but also myself, a board certified master nutritionist that's going to help you make lifestyle changes naturally, so that way you can keep these results going and you can feel better, and you truly will be anti-aging and balancing naturally. This is what homeopathic lifestyle looks like, and it is bringing in the best of science and the best of nature to help you anti-age, to help you feel your best. And I'm telling you, 40 is the new 30. And there's no reason why we can't feel better, look better, and anti-age, and fight back against those symptoms naturally, and prevent those cancers, prevent those diseases, prevent those sicknesses that tend to come on with menopause and perimenopause. So if you're interested in learning more, we'd love to help you. We'd love to work with you. And I invite you, check us out online, fitbodyweightloss.com. It is incredible, such a wealth of information. And like I said, you will be getting everything provided for you in an all-inclusive method. And what's so beautiful is we take it 90 days at a time, so that way we can monitor how you're feeling, how your mood is, how your body's responding. Are you getting, exactly what you need? And I want you to understand, we do the purest, safest, slowest going, gentle introduction of bioidentical, bioavailable hormone therapy available. You're not going to turn into He-Man. You're not going to turn into Hulk, I promise. What you are going to experience is better sleep. You're going to feel a better mood. You're going to like your family and husband and spouse again. You're going to enjoy being in public and going to events and working. You're going to have more zest and energy for life. You're going to feel more confident. Literally, did you know that confidence and literally the zest for life, wanting to go out, is a testosterone-based hormone? It's all created from that. You're gonna actually like to have intimacy and snuggle and hug and kiss. You'll be softer. Progesterone, oh, it's such a wonderful hormone. If you feel like you've been ruffled, literally, I describe it like if you feel like your feathers have been ruffled, it smooths it all down. It's your bliss hormone. It's your happy hormone. It makes you calm. It helps you rest. It gets rid of bloating. It has so many benefits, you guys. And I'm telling you, this is life-changing, and it's definitely worth giving yourself the opportunity to see if you can get back in balance again, because I know you can. So check it out, you guys, and you can learn more by sending an email to my clinic at fitbodyweightloss@gmail.com. You can also reach out to us through this video, through this message, and also you can call us at our clinic at 1-844-537-2408. And of course, if you're like, look, I'm ready, I want to do this, let's get started, you can get started today online on our website at www.fitbodyweightloss.com. Take the test, and if it will tell you right then and there what you need. You can order it right online, and we'll schedule you a consultation after that if needed. So there you go, you guys. It's time Take control over your hormone health, over your life. You will not regret it. Thanks for chatting with me. Have a great day, everybody.